Good morning, everyone. All right, we are going to go ahead and get started. My name is Emily Nelson, and I am the virtual host for this workshop this morning. And so I do have a couple of announcements before we get started. The first one is a recording disclosure. So please note that we are recording this workshop. If you would rather be incognito, please turn off your camera and change your name, or you can remove your name. We are not recording content from any breakout sessions. We do ask participants to honor the conference comfort agreements found on page 6 of your conference program or listed on the Peerpocalypse website. If at any time you need peer support, please visit www.peerpocalypse.com for a list of the on-call peer support specialists. And we ask participants to keep themselves on mute. And if you have questions or comments for the presenters, please utilize the chat box. And with that being said, I'm going to turn it over to Adrienne and Michelle.
Thank you so much, Emily, for being our virtual host today and for going through all of that information. I'm so excited because I keep admitting people, so people keep coming into the workshop, which makes me really happy on this day 3 Wednesday morning of Peerpocalypse. So thank you all so much for being here for the Peer Support for Pain online training workshop that Michelle and I are doing today. So my name is Adrienne Scavera, and I'm the Training and Outreach Director for Mental Health and Addiction Association of Oregon, a peer-run community-based organization that is putting on this very conference located out of the Portland area. I'm really excited to be here talking about this super important topic today. And I also feel very fortunate to have a fantastic person and co-presenter with me, Michelle. Michelle, would you like to introduce yourself?
Yes, thank you so much, Adrienne and Emily. I'm so privileged to be here. Thank you so much for having me. My name is Michelle Maricos. I am a peer support specialist specifically for chronic pain. I've lived with chronic pain since 2003. And so I work with Oregon Health Authority, Oregon Pain Guidance. I am a member of the Oregon Pain Commission. And I am just so privileged to be here, and I am from Southern Oregon, so a native Oregonian.
Thanks so much, Michelle. So we're going to briefly go over our agenda, and then we're going to have time for a networking opportunity for all of you to have the chance to connect with one another. So that's what we're starting out with. Then we're going to be going into supporting people living with pain, covering some peer support perspectives on pain care, on supporting folks who are living with pain and the role of peer support within that. We're going to talk about some of the existing resources that are out there, like the Oregon Pain Guidance Toolkit, videos, handouts, a lot of incredible free resources available in our state, and talking about how to use those in peer support. We also have a couple additional upcoming opportunities that we'd like to share with everyone. And we will wrap up with talking about some online e-learning work that we are doing on understanding pain for peer support specialists. So we've got a lot of stuff that we're going to cover today. And I'm really thankful again for all of you who are here with us to talk about this really important topic. So we are going to have networking breakout rooms. So we've got a couple of different questions for you to consider. You can answer as many or as few of them as you would like. In the spirit of peer support, we just want to offer options. So they include, who are you? What brings you to this workshop topic today on working with peers around pain? And what's the best thing about getting to be you? So we're going to have breakout rooms that will have for about 5 minutes, and the rooms will have between 3 to 4 people in them. So you'll have an opportunity for each person to share for about a minute or less if you prefer to speak less. And we will initiate those so you can see a little button pop up that will invite you to join a breakout room in just a second here. Our fantastic virtual host, Emily, can you please initiate those for us? Thank you, Emily. And I see a request from Kevin Fitz in the chat. Can I be in a breakout room with friendly people?
All right. And And I did put those questions in the chat box. Those should follow you to the breakout rooms as well. And so I will be opening up those breakout rooms now.
Thanks so much. I found that timer very helpful. Thank you. All right, looks like we have a lot of people coming back from the breakout rooms, which is always fantastic when we have the same number coming back that we started with. Always do appreciate that. All right, and Emily just confirming all the breakout rooms are closed, so we do have everybody back. All right, fantastic. I hope that was helpful to have a couple of minutes just to get to know some of the people who are here in this workshop and who they are and why they're here today, and maybe even the best thing about getting to be them. All right, so I want to start us off with a quote from Sherry Mead, who's really someone who's played a very important role in peer support and is a founder of Intentional Peer Support, or IPS. Some of you may have even had the opportunity to take an intentional peer support training. So Sherry Mead in this quote really breaks down what peer support means. And it's a system of giving and receiving help. So it has that mutuality that's founded on key principles of respect, shared responsibility, and mutual agreement of what is helpful. It's not based on psychiatric models and diagnostic criteria. It's about understanding one another's situation through the shared experience of emotional and psychological pain. And so peer support is really about honoring voice and choice of those we work with. Peer support is always voluntary, and we are working to support, encourage, promote hope for all those who we interact with. So we wanted to start with that as a foundation as we go into what peer support can look like when we're supporting our peers around living with pain. I saw a couple chat comments, so I just want to see that. Oh, it's just some comments regarding the breakout rooms. Excellent. So peer support works in many different settings, and I'd be hard pressed to find a place where peer support is not incredible and helpful and really brings a lot of value, both to those who are providing it and those who have the opportunity to receive peer support. So I'd love to hear in the chat places that you've seen peer support work. And it may be places that you've received peer support yourself, maybe that you know of, maybe that you've actually been that peer support for someone. So let's go ahead and get some of those going in the chat. And then we also have a couple to share as well, because there are so many places where peer support can be incredible. All right, I'm seeing some come in. Crisis team, hospital settings, hospitals, senior loneliness warm line. Fantastic. They're coming so fast. I'm trying to keep up. I'm not fully proficient with my device. Sorry, that's all right. Hospital, IOP, folk time, schools, jail, mobile crisis unit, NAMI, Clackamas, church, needle exchange. These are all fantastic. So across mental health, addictions, working with folks around things like diabetes or living with HIV, in health systems, I see judicial system, community, hospice, supported employment, TPI, employee assistance programs. There's so many fantastic suggestions coming in. I'm just trying to keep up with it. I love it. Drop-in centers, food pantries, places like parenting groups, just as someone said, maternity ward. Perfect, lined it up. Corrections, treatment centers or clinics, forensics, court system. I see recovery housing, ACT teams, recovery houses, adult foster homes, traditional clean/sober housing. So many awesome suggestions. And peer support also has a place in pain care that is not always an area of peer support that is talked about as much. So that's why we feel it's really important to have this conversation today. And I see more suggestions, schools and colleges. And Caroline says, I think that once you recognize the value of peer support, that it carries into your whole life. So the saying that wherever I go, I am is true as who you are. Caroline, I love that. Thank you. I think that's a beautiful way to wrap up the fact that peer support works in so many places because we really do bring those values and that lived experience with us. And with that, Michelle is going to take us into some information about peer support and moving beyond pain.
Thank you so much, Adrienne. So moving beyond pain, educate, support, hope. So we are so excited to be able to bring the concept of working with pain for peers. This is very, very new throughout the US. Oregon is the first state to be launching this type of program. A little bit of information about people living with pain. So 1 in 5 people in the US now live with pain. And in general, people living with pain do not seek any kind of peer support or pain education for an average of 9 years in their pain journey. So what we are doing is on the cutting edge, and we're so excited to be able to be doing this and, really bringing pain care to, the concept of transitioning what are traditional patients in a medical model, bringing patients back to people. So that's what we're doing with pain care and peers, and we're just so excited to be able to have these conversations with peers. And in my breakout group, it really was apparent that peers are already working with patients through their own experience through pain. And so we have started this program. We started working with Oregon Health Authority a few years ago because this was a concept that came to fruition through the Oregon Pain Guidance. And we worked with Oregon Health Authority to get, pain care and peers kind of melded together. And we're just really excited to be doing this. So our next slide is about the key concepts of pain, really about how all pain is real. And, whether it's emotional pain, physical pain, historical pain, pain is real. And, peers do such a wonderful job in being able to progress that concept through their peers. All pain is complex. Physical pain is very, very complex. And really understanding pain is this, the foundation of what we're going to be working with today. And that all pain can change, especially physical pain and the science around physical pain, that, neurobiology and the neuroscience around pain and how we can actually change the pathways through the brain, and that we can change physical pain and what that looks like. The new understanding about pain, that pain can change. It's a really very complex process throughout the body. But now that we understand that we understand pain in such a different way than we used to be able to understand it. A new awareness that helps both clinicians and people living with pain to understand pain better. We now know that pain can change, and that all pain is real, and that pain is not only related to bodily injury, but rather than the complex process involving the brain and the body together. This is a very hopeful message that can be life-changing for those who live with persistent or chronic pain. Next slide. So what are people living with pain missing, and what can peers do for them? It's really this, we have the pillars of what a peer support specialist is, but we're transitioning to pain care. So it's advocacy, support, and primary care, since that's where many people and patients living with chronic pain go is primary care. So we're going to meet them in primary care. That they need support, advocacy to get the services that they should have had in their pain journey from the very beginning. Education about pain. People living with pain have very rarely been introduced to what pain is and the education about how to work and self-manage with their pain. So it's a critical concept about education with pain. Education about medication, not only opioids, but the medication that they're going to be on with their chronic pain and their chronic pain conditions. So really an education about withdrawal and tapering also. These are really key concepts that people living with pain never hear, and that this is a place that peers can really fit in such a wonderful way of, using that experience to change what chronic pain looks like. Compassion and understanding that, we go into peer support. That's how we became peer support specialists, is that we had compassion and understanding for ourselves, and that we transfer that to our peers themselves. And how to live differently with pain. It's really this concept of taming the dragon. I also like to say it's kind of a metaphor of not having the pain be the driver but the passenger, that transitioning again patients back to people, that I'm going to drive the car. I'm not going to let my pain drive my car. The pain is going to be there. It's going to be a passenger, but I'm driving, and I'm, working with my pain in such a different way than we've ever done before. So next slide. So peer support in pain care benefits both providers and peers receiving services. This is such an important concept because really providers have come to this place of being lost with dealing with their patients with chronic pain. So it's really bridging that gap of understanding what patients are going through, and being able for providers to be able to hear that in a different way, that they will be able to hear what their patients are going through from a peer and not necessarily from the patient themselves. Peer support and pain care. So what does that look like? What does this actually mean? You're going to be a member of the interdisciplinary team. I always get caught on that. You're going to support and encourage peers and providers. You're promoting hope and education, utilizing your lived experience, whether it's lived experience with pain itself. And I know many of the participants today have pain themselves, and that using that lived experience to move people and providers into a different realm. Working with peers around self-directed goals, and what does that look like? Coming up with those concepts, and how we do that. Next slide. So you're really playing a critical role in bridging this gap, because this gap, it can be so wide with providers and their patients, and it's an amazing transition to see providers and patients in such a different way using peers, really helping reduce burnout for providers and clinics. Burnout is this concept, especially in primary care, where everyone in the clinic gets burned out for a myriad of reasons, but especially around chronic pain care, that because the system, we know that primary care was not built for chronic pain or persistent pain. It was built for more acute injuries. You come in, you have a cold, you get your medication, you leave, you don't come back. But with persistent chronic pain, the peers end up coming in again and again and again, and transition into actual chronic care. And so the system's just not built for that, and so burnout happens. And having peers in the clinics will be able to help providers, everyone on every level, the nurses, the PAs, the MAs, the actual schedulers, everyone in the system will be able to be helped by peers in the pain. Using tools like motivational interviewing to explore internal motivation and goals. We're gonna talk about that throughout this course also. Being able to support during difficult conversations. Difficult conversations happen most often with people living with pain around medication, around motivation of what to do with self-management, sleep. There's really a lot of difficult conversations that happen with people living with pain. And so peers will be able to fit right in to be able to make those conversations a tiny bit easier. Resource purveyors, we are, that's another pillar of being a peer support specialist, but the resource purveyors also for providers, being able to give good resources for providers to be able to help their patients receiving services. Next slide. So we've really identified some research about self-management and how it is a critical part of managing chronic pain. That this is throughout the last 30 years of pain care, we've come to the conclusion that we cannot serve patients only with medication anymore. That just doesn't work. So pain self-management is a concept that has been on the horizon, but it is actually it's being implemented now. And so this is the best evidence-based approach to pain management is self-management. And this article really goes into what self-management is. And we built the concept around peer support using self-management and how to use self-management in pain care. And so it's peer support is a unique role. And again, bridging that gap with pain providers and peers. And peer support can really help support these individuals in self-directed plans and the management of their pain. So we have really good, solid research to support these concepts. Next slide.
Thank you so much, Michelle. So we actually have planned in a quick 5-minute break for everybody. So it is 9:29. So that means we will be getting restarted at 9:34 if my math checks out on that. So I'm going to go ahead and type that in the chat. We'll be coming back at 9:34 to resume our presentation. Thank you all for. All right, and I did put a link in the chat to the research article that we were talking about briefly before the break, if anyone's interested in that as well. All right.
Okay, we are back. Thank you so much for coming back and being with us. So we love this little cartoon about pain treatment. Ask your doctor if taking a pill to solve all your problems is right for you. So this is the traditional method about how pain was taken care of for the past, in the last 30 years. People living with pain have been caught in the opioid and pain crisis. And it truly is a two-pronged crisis. And this was, 30 years ago in the 1990s, medication, it's a really kind of interesting story. And there's lots of articles about how we ended up getting to this point. But real quickly, that, it was an experiment. It was an experiment using pain medication, high dose pain medication to treat chronic pain with patients, and the experiment went wrong. And so now we are trying to fix what's happened over the last 30 years. It's going to take many, many more years. In Oregon, we actually started the Oregon Pain Guidance Group and really started working on, how to fix this problem in 2012. And so, 8 years later, we are much further than we ever have been, but we have a long ways to go. And, this really kind of brings up the concept of, how did we get here and where are we going? So we will keep working and trudging through the muck, but we have seen the light, and it's going to be much brighter day on the other side. So continue on. What are the hallmarks of pain care? What does this look like? What do peers need to work with working with other peers living with pain? So it really is patient education, exercise and movement, not necessarily just exercise, but movement, gentle movement also. Emotional support, there's so much we've heard throughout the day that really our emotions, our thoughts, and our behaviors really make up kind of the circle of what pain and the pain cycle is. So we want to add in peers to the team-based care, and this is a perfect model to do that. So we are moving forward with the hallmarks of our pain care. Next slide. So the key topics of pain care, we have understanding pain, sleep, nutrition, activity, which is movement and exercise, mood, social, flare-ups, and medication. So these concepts, we're using the pain education toolkit that was developed. The original toolkit was developed about 6 years ago through the Oregon Pain Commission, and it was originally it was a module for providers. And so providers would take the module and use it as a continuing education to relicense themselves. And in the last 3 years, we've actually spun the provider education toolkit into a patient toolkit. So there is now a patient toolkit and a provider toolkit. So we're going to be using the patient and the provider toolkits for training peers. And so originally it was only 5 concepts, and we added flares, social, and medication in the last year. And those topics of the toolkit are critical because we know that social interaction, flare-ups, and medication are really tenements to pain care also. So we're going to be using this in the training, and this is on the Oregon Pain Guidance website now. You can kind of look at the Oregon Pain Guidance toolkit, get some kind of concepts from that, and we will continue on using this throughout our education module for the peers. Next slide. So we are going to be there's provider videos and handouts. They really were built around developing common language and understanding about how to work with people with pain. So that's the provider videos and handouts. And then the education for the patients is patient education and patient handouts. So these are really wonderful tools, especially for peers, being able to train about the concepts and to be able to work with people living with pain, and having these resources about handouts and videos to watch with patients and peers, and to go over all of these, really important concepts. And every 2 years, these concepts, this toolkit will get updated with new information and new modules. So it's always going to be, it's not always going to be changing, but it's always going to be expanding. Next slide. So we're going to be introducing, resources to teams. This is, Adrienne, did you want to take this?
Yeah, absolutely. So we want to acknowledge that sometimes as peers, when we've got some new information and we've got something to share with our interdisciplinary teams, sometimes that may not be received as we want it to be received. So it can really help to think about our approach in terms of sharing information with others on our teams who may not bring that peer support understanding or lived experience. So sharing things like, I have some resources and some language that I've learned that I found really helpful. Would you be open to checking this out with me? Emphasizing that I want to make sure that we are using a common language and it's consistent with their messaging, because it can be really confusing for our peers if they are receiving support someplace and we use a couple of specific terms or language, And then all of the other folks on their teams are thinking about it very, very differently, it can really be like a situation of mixed messages and ultimately be confusing for those who are trying to receive supports. So it is important that as teams, we have a common shared understanding of what this can look like and of those really key facts that Michelle was sharing earlier, like the fact that all pain is real, that pain can change, that pain is complex and, a complex process that involves our brain, our body, holistically, all of us, with all of those important topics that Michelle just highlighted for us, looking at us holistically as human beings and not just focusing on one aspect medically or just one piece like medication. So really looking at all of that, including the social and the flare-ups and the movement and all those other critical topics. So we wanted to include this information today just to acknowledge that sometimes these conversations can be challenging and getting others on board with what is really a really new, innovative understanding of pain and the fact that there is hope because pain can change and all pain is real. And those are really important messages to remember and to make sure that everyone in a setting is aware of and really has that belief. Just like recovery is possible for all, pain change is possible for all too. And Michelle had already talked a little bit about this, the state clinician module, which is really where these online trainings started, was with that required module for clinicians to deepen their understanding of pain. It's called Changing the Conversation About Pain. And that is available online and can be really helpful if folks go, yeah, okay, I'm kind of interested in this, but I'd like to know a little more. There are free resources and already developed trainings that we can be sharing, that they can be accessing. And I saw a couple of people asking about these slides. Yes, we're going to share these with you. So you can just click right on these links. Maybe you even share this PowerPoint in its entirety to someone if that is helpful for you. And I see there are a lot of chat comments coming up. So I just want to check that. Okay, cool. People sharing email addresses. Fantastic. Lillian says more than our diagnoses. Yes.
Very much. We are not our pain. We are people. And this is the basis of how this was created, was really, having patients go back to being people, and that validation piece of being heard, being understood, and being able to change the way we deal with our own pain. That I live with chronic pain. I cannot give my chronic pain to my doctor. So, the concept of I'm the only one that feels it. So I'm the one who has to self-management. And so using a peer in that sense of being able to understand those concepts and really, come back to creating a partnership with patients instead of a, push you, pull me, relationship. That we want to partner with our patients, partner with our peers. I use patients and peers in the same languaging. And that, really it's not just one thing that we need to do, it's a spectrum. And that there is, so many things that we've, kind of thrown at you here, but it's, we're creating a very healing environment for people and ourselves.
Awesome. Thank you so much, Michelle. So I'm excited about what we've got coming up, which is Mentimeter polling. So what we're going to do is get a link in the chat that everyone will be able to click on to go to a live poll that has 3 different questions on it. Awesome. And I see Emily just shared that in the chat for everybody. The first is, what scares you about working with people living with pain? So we can have a real conversation about that. Second question is, what questions do you have about the role of peer support in pain care? And finally, what strengths do you bring to working with peers around pain? So if you click on that link that Emily just put in the chat, that link that says menti.com and then a bunch of letters and numbers after that, if you click on that, it's going to take you right to that poll where you can actually enter your own answers And then that is going to form into a slide for Michelle and I to share with all of you to see, get a sense of what y'all are thinking, what questions you have, what fears you might have, as well as that ever important question of what strengths do you bring, really acknowledging those strengths within ourselves. So we're going to take a couple minutes to do that. So I hope folks are going to that Menti link in the chat and starting to answer some of those questions. Does anyone have questions about that? Awesome. I see one answer has been submitted. I love that. I can see them coming in live.
Adrienne, when I click on it, it doesn't go.
Okay, let me try again. I'm just going to put that in the chat once more.
Okay, I'll go through the chat.
Yeah, we just put that in again. Did that work for you, Michelle?
Yes.
Awesome. So glad. And one tip I've learned, sometimes if the link in the chat doesn't work, if you copy paste it and put it directly in your browser, sometimes that works a little bit better. So I know different computers, different devices sometimes work with us a little easier. Thank you, Nabel. Appreciate it. Able to use the link. I see that. Awesome. And I see these answers coming through and I'm excited about them. So we're going to leave this up for another minute or two just to give people more time to get responses in. I see we already have 16 responses, which is awesome. I love it. Just a little bit more time here. And then I'm going to stop sharing the PowerPoint so that I can share this with all of you so you can actually see what other people have to say on these important questions. All right, are folks seeing a lovely mint green color come up? Awesome. So wow, we've had 35 people respond to this so far, which is fantastic. So in a little bit, I'll start to go through these with everybody. Just want to make sure if you need a little bit more time that you've got that today.
These answers are really wonderful, and we can chat about kind of all of these concepts too, because in our training, a lot of these things will be addressed. And hopefully, the reason that we ask this question is because working with people living with pain, myself being a person living with pain, we're a difficult population. We're not an easy population because pain is such a horrific experience for most people. So, we ask this question not to bring up the negatives, but to bring up concepts that we can work with.
Thank you, Michelle. And wow, there are so many answers here. I actually just had to scroll down to see how many there are. This is super exciting, and we actually can save this as well, so this can be shared with y'all additionally. So what scares you about working with people living with pain? I love that those first two responses, nothing. Feeling confident, feeling capable, you know that you've got this. It challenges the fixer/rescuer in me. I bet a lot of us in peer support can connect with that. Someone saying, I don't have lived experience with pain. All right, that I cannot help is a fear. It's hard to watch people suffer, that I won't know how to support them. Being dismissed by professionals, same thing I have personally experienced as a service user. I see a lot of answers that are connected to that fear of not being able to help or not knowing the right answer. See that come up a bunch of times. I see another nothing that I know of. Love that confidence. Inability to help increase in my pain levels. Okay. And then relapse, I see that come up a couple of times. And then another person mentioning, not having that personal lived experience of pain themselves.
And throughout the modules that we're going to be using for the training, the lack of experience is actually the education piece will solidify that, of that you're going to learn about how pain works in the brain. So it will make that lack of lived experience, you'll see that in a different way because you're going to have the education background that people living with chronic pain never had to begin with.
Yeah. Thank you, Michelle. And really, I mean, bringing those peer support skills of connecting with people, with empathy, with compassion, supporting people on their own journeys, those are still going to be really valid and really helpful working with folks with pain. Even if you don't bring that specific lived experience yourself, you can still be a resource. You can still be a source of hope, a source of encouragement, a source of support.
Very much so.
Awesome. And I know we've got limited time, so I can't read all of these, but I just want to respect how amazing all of these are. And I'm definitely going through after this and reading every single one.
And two, we will send out these slides to the group because these slides will be saved with everyone's answers. And of course, the answers were anonymous. So everyone will be able to have these slides as a resource also.
Awesome. Do folks want to take a look at question 2?
Yay.
Awesome. Okay, I see some head nods. Let's do it. What questions do you have about the role of peer support in pain care? What are some of the ways to support someone that do not involve working in tandem with a PCP? In my crisis role, this would not be appropriate. What can we do? Will the providers understand the scope of practice and not ask us to do things outside of our scope? How can I get involved as a peer wellness specialist to work with this population? These are all fantastic. How do I support someone with severe and consistent pain if that's not something I've experienced as a peer? So going back to that lived experience piece that has come up a couple times, throughout this. Best proven techniques to support my peer the best. How do I deal with someone's learned helplessness when someone doesn't believe that what they do can make a difference? How do we find these positions? How do we make ourselves available to medical organizations? How can we assist people to their fullest potential? Nothing, NA. Does it really work? None right now. For questions, how can I best support someone through an extreme pain episode that isn't getting better with regular avenues? These are all really fantastic questions. And like Michelle said, we are going to be saving these so we can fully review these and then can really think about that with regard to our online training that we are developing.
These are really wonderful. And thank you so much for putting time and effort into these questions, because this will really help us move forward with the modules, move forward with our training. And, as you go through the modules, some of these questions you might get answers to, because there is so much good information about flare-ups, about social interaction, about medication, and what to do as you're not going to be a provider, but they're in the provider module. There's really good answers for a lot of these concepts too, that we're going to be adding into the online peer course.
Yeah. And we did earlier, and I can share this again as well, share a link to the Oregon Pain Guidance Toolkit, which has so much information. It has videos, it has handouts, it has online resources. It has a bunch of tools that can be used that do respond to a lot of these questions. And what Michelle and I are doing is with the online training is really bringing that peer support lens to it. Awesome. These are all excellent questions, more about how to be there for the person experiencing pain.
Mm-hmm.
Awesome. And then our next, and I do see a couple chat comments that I want to read as well, because I think those are related to what we're talking about. All right. There's some, I'm scrolling backwards because there's a lot of fantastic comments. So I want to check them all out. From Emily: to be dismissed over and over is exhausting. Having someone also not take it seriously or blame my mental health diagnoses is so frustrating.
So many times people
Thank
say
you
that
for
they feel
sharing.
like they're on a merry-go-round.
Yeah.
And it does. It becomes a merry-go-round of treatment, of being dismissed, looking for different doctors, looking for different diagnoses, and you get caught into this merry-go-round cycle. And how do you get out of that? And that's where we're, coming in with the peer support.
Yeah, and that's one of the things that we really emphasize in the online training that we'll be talking about in a minute, is that all pain is real. All pain is real. And some people may have had very different experiences with that, or been dismissed or not believed. And like Emily said, that can be exhausting. That can make us feel like, okay, maybe I'm not going to talk about it, or maybe I'm not going to try to seek support around it, because every time that happened in the past, maybe the response was, oh, it's in your head.
Yes.
Or
so
not being
common.
believed.
That saying is so common for people living with pain, that it's all in your head. And we know that that's not true.
Yeah. And then a couple people just validating that comment from Emily. Awesome. Bill asking, I'm curious how many of us in this workshop live with chronic pain? And Shane says, absolutely. I always think about post-surgery, a doctor telling me my pain medication wasn't working because I have anxiety. What? That was in the comment. Sorry, Melinda, please share again, which piece were you requesting?
The toolkit, I put it in the chat.
Oh, awesome. Thank you so much. See, I haven't even scrolled down that far, and Emily already took care of it. Appreciate
You
it.
did. Yes, thank you.
Awesome. Thank you so much. Cynthia shares that they've lived with persistent chronic pain for the past 18 years, and there is that toolkit. Thank you, Emily. Lauren says it's a totally exhausting cycle. Having someone to walk through that with me would be awesome, and I would love to be that for others. Sounds like peer support. I love it. And Emily shares, to find one person to believe/validate my experience can turn my hopelessness to hopefulness. Absolutely. That's why we try to emphasize the hopefulness of the message that our experiences can change, our brain can change, all pain is real. And Charlotte shares that telling me my weight was the problem. Crystal and Emily, both of us have chronic pain here, 14 years, and long as I can remember in my life. Thank you for sharing that with us. And Jay says, make you want to hit the doc and say you didn't feel that. That may not be a recommended strategy, but I understand the feeling, Jay, that you may be coming from. Because it does feel very challenging and frustrating to feel dismissed or not believed, when we're trying to be real and authentic with someone, and the vulnerability of sharing about a challenge, it takes courage to be able to do that, especially if we've had struggles in accessing healthcare or not positive experiences in the medical system in the past. It really does take courage to say, okay, I'm being vulnerable and I'm sharing about my experience. And that's why it's so important that we treat everyone with respect and believe them for their stories when they have the courage to share that vulnerability with us. And Lillian says that weight thing is painful to hear over and over again, when weight is the symptom, not the cause. Thank you, Lillian. And a couple of people validating Jay's comment as well. And John specifically asking for a PowerPoint about that approach from you, Jay. Oh my goodness. Awesome. All right. Well, we have one more question that I want to bring up. Our third question, which is, what strengths do you bring? And just having the chance to work with all of you over the past, gosh, it's been just about an hour. I can already see a lot of strengths happening. And so I'm excited to see what you have to say and what you acknowledge about your own strengths that you bring to this work. So my own chronic pain experiences, lived experience, and infinite compassion, empathy, chronic pain experience, open to learning, patience, compassion, having my own personal experience, knowing that pain ebbs and flows for some. Also knowing how discouraging it can be to work with doctors who don't understand. So I have empathy for people's situations. Lots of folks talking about their own personal experience here, and also encouraging folks to connect with others experiencing pain. Good at resources, and I'm a great advocate. Compassion, very empathetic. Open heart, open mind, compassion, safe space. Get to love people and learn and grow with them. I'm good at listening and good at being there for someone who may want or needs support. On pain management myself, someone says, lived experience, a lot of that coming up. Living with pain and knowing the struggle of trying to find peace. My age, my life experience, and my willingness to keep learning.
These are such wonderful, wonderful. This brings tears to my eyes because I have wanted to do and put this into practice for so long, because I know that so many people living with pain are, on an island by themselves, and that this is such an encouraging, all of these answers are so wonderful, and that we're going to create this support system for people like ourselves living with pain without support. And I'm so encouraged by this. This just brings like tears to my eyes. And this is just, thank you all so much for participating in this. This is really important work.
Wow. Thank you. Thank you, Michelle, for your vulnerability and sharing too. And I agree, like this, there's so much passion and feelings around this, because this is such an important topic that I feel like we don't always talk about in peer support, or we don't always acknowledge that part of ourselves. And so I love how everyone is so open and sharing and really just engaging. And like Michelle said, this gives me hope for the future, knowing that people with pain, living with pain, will be able to get the supports that they need. Just knowing that all of you are out there and bring so many strengths, and that just gives me hope for what things can look like. So thank you all.
We are no longer going to be an invisible population. We are going to be visible, and we are going to get the support that we need.
Yes, I love that. A couple more comments I want to read in the chat, and then I will bring us back to the PowerPoint from our results page. So Lauren says, lived experience and passion for supporting others. Fantastic. Carolyn shares, I had a woman doctor once in OJT exam tell me you must be very self-centered when I could identify my pain. Gosh, sounds like you have a lot of good insight and like connection with yourself if you can identify the pain. Wow. Invalidating to hear that, I imagine. Christine, I lost 100 pounds, did yoga, started running, and still the pain and weakness progresses. They finally show the test and I shouldn't be running. I have the back of a 50-year-old, but I'm 33 and too young for them to fix it. That sounds tough. Stacy, I currently work at Quest Center for Integrative Health as a WISH wellness peer in pain management. There are great trainings on peci.com. Good to know. Thank you. Lillian says it would be great to be able to bring the different areas of peer wellness support from being compartmentalized and be cross-disciplinary. Yeah, through things like this workshop and later through the pain training, we're really trying to bring that cross-disciplinary or interdisciplinary approach with terms of resources and being able to work with folks outside of the peer support or peer wellness realms who also may be providing supports or services to those we work with. And Cynthia says, hopefully some of this work will focus on the grieving process of leaving behind who we were prior to the pain, losses in what we can do, quality of life, independence, activity, etc. I think that is a great point and really helpful feedback, Cynthia, not Cynthia, sorry. Just acknowledging that grieving process and loss. Thank you. All right, so I'm gonna bring us back to the PowerPoint. There we go, awesome. And can I get thumbs up if folks are seeing the PowerPoint again, just to make sure I'm not sharing my email or something like that. All right, So thank you all so much for participating in those Mentimeter polls. So much valuable feedback and thoughts that you've shared in that. Definitely saving that so we can review that more carefully, you know, one by one when we have the time to do that. And then we'll be sharing that with all of you as well, because really a lot of valuable things were shared there. We did want to highlight a couple of upcoming opportunities. One is happening very soon, actually next week, next Tuesday, and it's called Changing the Conversation About Pain webinar that will be taking place at 2:30 p.m. Pacific Daylight Time. So if you're joining us from a different time zone today, please note that that 2:30 is Pacific time. And the presenters for that webinar are going to be our very own Michelle Maricos and Nora Stern, who is a fantastic pain educator and physical therapist, director of Know About Pain consultation as well. So if you would like to participate in that webinar, it's free. It's going to be 1 hour long, and it's really going to be going a lot more. Well, we've talked today about the role of the peer in pain care and really focused on the peer support side. That webinar is going to have a lot of information related to the pain science aspect as well. So if you would like to attend that, we would love to see you there and see some friendly faces.
We put the link in the chat, Adrienne.
Awesome. Thank you so much. Appreciate it, Emily. The other opportunity that is coming up is the Oregon Pain and Addiction Treatment Conference. That is taking place a little bit farther away than next Tuesday. That's in early November of this year. They are soon going to be launching requests for proposals on topics like addiction, pain, social justice, recovery. And do you happen to know, Michelle, are those out yet, or those are going to be coming out very soon, I believe?
Yes, so the launch for proposals, so the Oregon Pain and Addiction Treatment Conference, it's called OPAT. And that actually is being put on by Oregon Health Authority and Lines for Life. And Lines for Life is such a wonderful, place to be putting this on, because they are trained in mental health and addiction. So they put on this conference every year for the past 3 or 4 years. Beforehand, it was Oregon Pain Guidance that was putting it on. And Oregon Pain Guidance is still very involved in the OPAT conference. This year, they are launching the proposals. The proposals request is on their website, and we encourage everyone to fill out, if you're doing anything cool in your area that has anything to do with pain, addiction treatment, social justice, any of the pillars of the conference, go to the website, fill out the call for proposal. And then if you don't have anything to propose, then that's fine too. We encourage everyone to attend the conference. It is going to be in person, and that's why it was moved to November. And it will be in Bend. It is traditionally always in Central Oregon, so that lots of people from lots of different areas can attend. And it's just a really great conference. And on their website, they have videos from previous conferences that we've done. And so hopefully Adrienne and I will be doing some breakout sessions also. So we would love to have all of you attend.
Thanks so much, Michelle. We did put the links in the chat. The first link that starts out with MHTTC Network, that is going to be for the webinar, Changing the Conversation About Pain with Michelle and Nora. That's coming up next Tuesday. So that one's coming up really quick. And then the second link is for the OPAT conference. And I see a question, what is the cost of the conference for the OPAT?
That is a very good question. And there is, through Oregon Health Authority, there's a special scholarship fund for peers, because Oregon Health Authority knows that peers are a very important part of this realm. I don't know the exact cost, because it's supposed to be in person. We don't know if it's going to be in person, all of the things. But there is a scholarship fund, and the scholarship fund for peers is on the website. So I encourage you all to apply for the scholarships, and the scholarships will, I believe, be covered at full cost through Oregon Health Authority.
Fantastic. Thank you, Michelle. That's really helpful information. And I know we've got, months until we're at that point. So more information is going to be revealed as it gets closer to the winter launch date of that conference. But the Changing Conversation About Pain, that is 100% free. It just costs a minute of your time to register and then to attend, hopefully 60 minutes there. All right. So we have some information to share about the e-learning continuing education unit training that we have alluded to, and some of you may already be familiar with. Some of you may even have had the opportunity to preview it with us with one of the peer groups that we did. Gosh, I think it was in February. So a little bit of background about the online training is it was funded starting in 2020 by the Injury and Violence Prevention Program at the Oregon Health Authority, and they're really committed to this work and really promoting the role of the peer in pain care, recognizing the value of that. And so for this training, we at MHAAO have been working with a couple of fantastic subject matter experts and consultants, like Michelle Morikos and Nora Stern, the 2 stars of the upcoming webinar on May 11th. And the CEU is going to be free. It's going to be available online. It is what's called asynchronous. So that means you can take it on your own time. It's not live. You can just take it whenever it works for you. You can pause it. You can come back to it, whatever works. It includes information on understanding pain, really covering that piece of pain science, some really solid information there, and includes some video clips from the understanding pain training that is already developed through the Oregon Health Authority and Oregon Pain Guidance. And it also has connections on how we can actually use the information that we're receiving in peer support and what that can look like. It also does have some quiz questions throughout, so there's opportunities to really reinforce those key takeaways and learning that is happening throughout the training. We hope to be able to launch that relatively soon, either spring or summer of this year. So we're really excited to be able to officially launch that and get that shared out with everyone, so everyone across the state can have access to that free online training on understanding pain and peer support for pain care. All right, so we've got about 15 minutes left. So we wanted to leave some time for Q&A to see if there were any questions, comments, feedback from folks today.
And you can also drop questions in the chat box too.
Yes, absolutely. Okay, I see our first question from Juliana. Can people outside of Oregon also access the training you were just sharing? Yes, it's not limited to Oregon. However, it is continuing education units for Oregon peers. So if you were not an Oregon peer, we can't guarantee that within your state you would receive credit for it, but you can still take the training and benefit from the knowledge of it.
But hopefully in the future too, we will be working with more states on this and, kind of putting it out in the atmosphere, in space. We're going to the moon.
Yes, love it. And I see a couple hands up. Cynthia.
Yeah, I was just wondering about traumatic brain injury in terms of people who suffer from persistent or chronic pain. I'm dealing with a few peers right now who have a history of traumatic brain injury. And there's a misconception that TBI is just caused by major accidents or wounds to the head and so on. That's just not true. It could be something as simple as a blow to the head. Say if you're a victim of domestic violence and your partner has punched you in the head, that could cause a traumatic brain injury. And what I know from my personal experience and what I'm learning from my peers is that there is definitely some kind of connection there. and there doesn't seem to be a lot of information that takes that part of TBI into consideration. So I'm wondering if there are any plans on looking at that in terms of chronic pain and living with chronic pain.
So within the training that we're talking about, that isn't one of the topics that it dives into specifically. It is more of a broader overview on understanding pain and some information about the current pain science. So it's not diving into specific situations like traumatic brain injury that you described, but I do really appreciate that comment and think that's really helpful feedback.
I believe Lillian has her hand up.
Oh, excellent. Thank you. Hi, Lillian.
Hi, me again. Sorry. What I was referring to in terms of interdisciplinary, I meant for peers themselves. It seems like the THW separates adult mental health, youth, family, and this pain aspect seems to be separated too. It seems like all these different areas are siloed, and when really they cross over, because I've had family issues, I have children who've had SUD and undiagnosed mental health. I myself deal with chronic pain and mental health stuff. And so it feels like peers are being segregated into these different areas when we're so much more than that.
Thank you, Lillian. I appreciate you sharing, and I want to acknowledge that that is currently how certification and training is set up, is respecting different subtypes or categories within peer support or peer wellness, including family support specialists, youth support specialists, whether it's adult mental health, adult addiction. And so that is currently how it is set up. But I think for things like the peer pain training, we're hoping to reach anyone who identifies as a peer, not specifically saying, okay, you need to be an adult mental health peer support specialist. But if you are interested in this information, I do believe it will benefit anyone who is willing to, make that commitment of their time and energy into taking it. And also many people like yourself, Lillian, have that intersectionality of multiple experiences, multiple areas that we may connect and identify with.
And so many times peers wear so many hats too. So this is, really, yes, a broad training to, everyone is going to wear, these many hats. And, in this training, you will see all of that too, where there is family support, there is, there's so many different things wrapped up in a peer, and that we are, we all wear these many hats.
Thank you. And I see a couple comments from the chat, I believe connected to Cynthia's earlier comment. One from Lauren: it's also my understanding that anytime your brain doesn't get oxygen, like strangulation, can cause TBI. And Shane comments, TBI was such a big part of my pain and chronic fatigue becoming elevated. And Caroline comments, I believe that the learning I seek and receive doesn't have to be CEUs or divisional, but to expand my own learning. I think that's a fantastic perspective, Carolyn. Thank you for sharing that. All right, we have got a couple minutes left. Just want to see if there's any other questions. I'm just checking in to see if there are any other hands raised. I don't see any hands up. Feel free to type in the chat or unmute and share.
I believe Jay has his hand up. Jay, do you want to say something? You're on mute. There you go.
I'm dealing with my significant other, dealing with a lot of back pain and sciatic pain. Stems from a workman's comp claim, and they always say it's a pre-existing condition. And I just wonder how many other people out there have heard that phrase. I can tell you, you don't want to get hurt at work. Don't help clients lift things, and be very careful about take care of your body, because if you get a workman's comp claim, it'll be a pre-existing condition and you won't get any help that way. And she has been, like somebody said, on the merry-go-round, and pain management told her it was all in her head, and that she, physical therapy hurts her, and it's just, it's so sad. It makes me question our healthcare system and what they do, because really all she needs is a back surgery for a slip disc. And so it's just, you need to really take care of yourself so that you don't fall into that same trap of being in chronic pain. It is a terrible, terrible thing. And it's life ending. I mean, she has no way of getting out of the house, except in extreme pain. It can happen to anybody at any age, and I just want everybody to know that. And it's one of those things that we need to realize how fragile the body is, and it can happen to anybody.
Thank you so much, Jay. You brought up some really good concepts. One of the concepts about resources for people living with pain. Lots of times, peers will end up having to, use resources around workman's comp, figure out what workman's comp, working with workman's comp to try and help people living with pain. Also, disability claims. A lot of times, in my experience, I've had to work with peers around their disability claims, helping them with paperwork, understanding paperwork, and how that can be so complicated as a peer support specialist working with people with their paperwork, and having that understanding that those get very, very complicated very, very fast, and having the resources to be able to help our peers, be able to kind of see the forest through the trees in those situations with disability and workman's comp claims. But also, you brought up the concept of, really about, how we need to take care of ourselves as peers too. And that, that's one of our pillars in, taking care of ourselves in order to take care of others. What does that look like? And we put that in the training also of, really as peers, we can't overextend ourselves or we won't be able to help anyone.
Thank you. Thank you, Jay, for sharing. And thank you, Michelle, for responding so well to that and sharing some great information. I see a bunch of validation in the chat, Jay, from some individuals who have gone through similar, it sounds like, and also just, being sorry that that's happening, because it's so awful and challenging. And Cynthia sharing a resource said Cynthia has started teaching seated exercise and seated yoga groups for those with mobility and pain issues. Okay. And it looks like that is in Ontario, Oregon at the Peer Center, but there are plenty of videos available online for that if folks are not in the Ontario area. Caroline says, and keep on learning about pain and pain management, new stuff all the time. Yeah, there is, and I think we already said this earlier in this workshop, Oregon is really innovative. Oregon is at the forefront of so much when it comes to pain science, and all the resources that are available, like the Oregon Pain Guidance Pain Education Toolkit. That is really cool. And a lot of people find that really helpful. And so I'm glad that we, are based somewhere where that information is available. And the cool thing is, because it's online, you don't need to physically be in Oregon to access it. Wherever you are from, it can still be a resource. It can still be something that you walk through with your peers if it's a tool that they might be interested in using.
And it's so helpful too, because it has lots of tips and tricks.
Mm-hmm.
So I've realized as a peer support specialist, a lot of things are just tips and tricks of like, have you, can we try this? Can we try that? Let's do this. Let's do that. A lot of peppering of information and a lot of tips and tricks of, what works here. It may work. It may, let's try this other thing. We have, that's why we call it a toolkit, because it's like a toolbox of like, put all the tools in there and pick out which one we need on which day.
Yeah. And Caroline adds, we need to be a part of the solution, not a part of the problem. We've all heard this over and over. I know I have definitely heard that as well. Thank you. So I wanted to make sure that everyone has our contact information in case you have any questions or want to talk more, want to follow up with us. I did see that there were a bunch of email addresses that were shared in the chat a bit earlier when we were talking about sharing these slides. So I am going to download that chat to make sure that I have that saved and available so that we can follow up with people to share these slides. And I hope that we will see some of you next week, next Tuesday, 2:30 p.m. Pacific at the Changing the Conversation About Pain webinar. Awesome. I love that there are even more emails being shared in the chat here. So I am going to resave it just so I have the current version. Oh, and they're coming even faster than I can save. Okay, how about this? I'm going to wait to save it until we officially end the workshop, and then I will have all the emails. But really, I just want to say appreciate so much all of you for being here, for your engagement, for the incredible responses to the questions. I loved looking at the strengths that everyone brings, as well as that vulnerability and talking about some of the things that scare us about working with people with pain and considering some of the questions. I appreciated how so many people really got open and honest and shared about your experiences with pain and what that was like for you, as well as some of the things that you have found helpful. So I really thank and appreciate everyone so much for being here with us today on day 3 of the Peerpocalypse conference. And Michelle, if you have anything you would like to add, please feel free.
I just want to thank everyone for being a part of this. I commend our workforce. I am so thankful for all of you. I'm so thankful for all of you committing your time, your energy, your resources, your emotional support to this population that we are a part of. Chronic pain has affected so many people in such a negative way, and we want to change that. We want to do something different, and I'm so thankful for all of you. Hand over my heart. I'm just I'm so excited to have all of you do the wonderful work that you already do with people living with pain. And I encourage you, if you have any questions about working with people with chronic pain, please email me. I have lots and lots of resources that I've put together, and I love to hear from all of you. Thank you so much for having me.
Thank you, Michelle. And I see Kathleen comments in the chat. This was the best workshop I've attended so far this year. Thank you. It's all of you with your engagement and your questions and your strengths and your experiences that make this so valuable. So I just want to share appreciation again with everyone for being here. And I hope you all have a fantastic rest of your day and fantastic rest of the Peerpocalypse conference. So thank you all so much for being here. We are going to end the workshop here in a minute, and I'm going to be downloading the chat to make sure that we've got all of the emails.